And the money was handed out, again, based on peer-reviewed grant systems. It wasn't just given out. But if you were successful in getting a grant, you had to check off on the list, if you receive the money, you have to participate in 2 meetings a year and share all your data. And in our business, we always collaborate, but you don't get promoted based on your collaborations. You get promoted based on your own success. And so we all came together, and we were all nervous about this experiment, saying, I'm not sure how it's going to work. Now I'm 3 years into the system, and I think it's the most spectacular experiment NIH has ever done, because it does work. People are much more relaxed than they were, and they realize that the questions that we put up are much bigger than any one small lab. And so we rely heavily on our colleagues for reagents, for assessing these cells, and for eventually moving these much closer to the clinic. It's not a single lab, it's a group effort. And it just so happens I belong to that group, but we're trying to establish a group in Toronto to take on the challenge of taking regenerative medicine forward in the city. And together with Derek, we're trying to move this forward as best we can.
Thank you. Okay, can someone bring that lady a microphone, please? Actually, wait for it, because then everybody can hear your question. Go ahead.
My question is about the immune system. You were talking about that. I was going to ask you, were you able to identify why the immune system attacks your pancreas cells? What's the reason? Did you do any research on that?
So let me just repeat the question. The immune system, the question is, have you identified why the system fights against its own cells and why this immune system is activated?
And then, sorry, I have another question after.
Let's answer this one first, then we'll let you ask your next question. They have short memories, these guys. They have lots of information. Yeah.
I don't.
Go ahead.
It's a great question. It's currently one of the biggest issues in diabetes research. Sorry. Some people believe actually that insulin itself is one of the targets for the immune system. So the release of insulin actually stimulates in a way that's not clear the immune system to attack the cells that are releasing insulin. It turns out that the immune system is attacking a lot of different cells. So another hypothesis, another idea, is that the nervous system actually innervates. So nerves come down to the pancreas, and they actually provoke the initial immune response in the pancreas. And then once a few beta cells start to die, they release all of their contents, and the immune system reacts against all of those different things that are in beta cells. So it's currently a really hot research area. What's the basis of the autoimmune response in diabetes? And it's not a solved question yet.
Do you want to make any extra comments about that, Gordon?
No, I'm...
Okay. Your second question?
Yeah, just based on your answer, if you are saying that basically one of the reasons is that your insulin itself is not a quality insulin, then with the use of stem cells, you will going to reproduce your own bad insulin, so it's not going to help. Your immune system will still attack it. So what's the solution then?
So there's two sets of solutions that people are thinking about. One is when you transplant, for example, insulin-producing beta cells made from iPS cells. As Gordon mentioned, that avoids the barrier of transplants from one person to the other, but it doesn't avoid the autoimmune attack on your own beta cells. So one of the approaches is to actually encapsulate the cells. So make a lot of beta cells from iPS cells, and then put an artificial coating on them so the immune system can't get at them. And small holes in the encapsulation, in the coating of the cells, allows insulin to get out, but not immune molecules to get in. So that's one sort of approach. The other approach that people are doing is to try and change the immune system, to try and re-educate the immune system so it no longer reacts against its own cells. And that's a much bigger problem, but people are working on that issue right now.
Okay, anyone else have a question? Microphone back there. Thanks. Dr. Ehrlich, who has worked for many, many years taking care of children with diabetes.
There were some reports of tumors developing after stem cell transplants. Could you comment on that?
That's you, Gordon.
Yes, I mean, obviously the downside or concern with embryonic stem cells, maybe less concerning with iPS cells, is they will form, if put into an individual, tumors. Certainly in mouse to mouse, they are tumorigenic. The problem with the studies that you're probably referring to is they did not have well-differentiated cells or very pure populations. And those types of experiments do not help the field at all. They're sloppy experiments. They're not well thought out. And if we can be very honest, they are quick to publish because they get a few differentiated cells and they put the cells in. We've not done much transplant yet. Actually, we've got quite a few transplants going with the insulin-producing cells. We haven't really seen tumors, and we've done a lot of transplants with the heart cells we've made and never seen a tumor. So if you have good, pure populations, the risk of tumor is much lower. It's never, it's never zero. There are, I think, genetic ways to make it virtually zero. So it's a good point. It's something that we all think about, but there are ways around it.
I just comment that I think that that is the bad side of stem cells. The nice thing about stem cells is that they can make lots of copies of themselves and large numbers of cells. But of course, some people believe, and it probably is true, that cancers are caused by the uncontrolled proliferation of stem cells. So part of the good thing about stem cells is also something that could actually lead to tumors. And methods to control their proliferation so they don't lead to tumors is a really important thing.
Any other questions? Yes, can we have a microphone in the front, please?
I had heard that there was research going on in Brazil with transplant of stem cells. There seemed to be some success in that they had patients last 24 to 36 months on this work. Is that the kind of work you're speaking about? That might be a bit sloppy, or have you heard of this?
I think you may be referring to pig islet transplants. Was it stem cell as well, man?
I'm not sure what you're referring to, but I think it's an opportunity to discuss a subject that we call stem cell tourism, and it is a growing area of concern in the field. And you can just go on the internet and Google stem cell therapies, and 3 or 4, 10 sites will flip up at you and say, come to us and we will give you stem cells for every disease that you might have, and you will benefit. By and large, these are fly-by-night organizations that are preying off people with diseases. And there's a lot of discussion now whether or not one should do something about this. It's up to the patient to make their own decision. There's very little data behind most of these claims if you're talking about taking. The most common one is umbilical cord bloods injected into every part of the body to fix everything, and you can go on the websites and find these things. If it's not tried and true, if there's no clinical trials, if there's nothing being done in North America or in Europe, you wonder why. If it's good to, the general rule of thumb, if it sounds too good to be true, it's probably not. And it really is an issue. It's a concern nowadays.
I'll just add that standards for human ethics approval committees that vary across the world. So when we do research in humans in Canada or the United States, very rigorous process that we go through that's reviewed by many people and very high standards. You can't just do any experiment. So this varies across the world, and there are, frankly, lower standards in some places.